In today's episode, we'll be exploring a very important and perhaps underappreciated aspect of health, mitochondria and the cell danger response, a concept that's causing many clinicians to rethink how we consider fatigue, inflammation, and healing in general. The mitochondria are the centers in every cell that produce energy for a given cell. What's interesting about the mitochondria is they have a dual function of being sentinels or purveyors of stress. And this stress could be the form of emotional stress, inflammatory stress, infectious stress, toxins. When the stress persists for long enough, the mitochondrial cells can then shift into a protective state known as the cell danger response, where energy production in every cell is turned down. And this can occur, and it might be what underlies chronic infections, the chronic stress response, impaired gut health, autoimmunity, long COVID. And so to help us better understand and appreciate this cell danger response, I wanted to bring on Dr. Paul Anderson. He's a physician and educator and really an expert in chronic illness. Today we'll cover the early warning signs of mitochondrial dysfunction, how toxins, infections, and even emotional stress can trigger that cell danger response, important nutrient therapies that restore mitochondrial function, including oxygen, red light, and key nutrients, and then how we can help to use these tools to move the mitochondria from stuck in this cell danger response and allow them to regain function, therefore having better energy of the cells and every organ and system those cells comprise. So let's get started. Dr. Paul Anderson, welcome back to the show.
Thanks for having me.
You know, it's been a while. I think the last time we caught up in person was a SIBO symposium. This may have been like 2016, going back quite a while. But, we're both still here.
Yeah.
I'd like to think fighting the good fight, helping people understand why their body won't respond. And I think we see both of us, people who are, I would say, at the varsity level, right? They're usually eating healthy, they're well-read, they're well-educated, but sometimes they're just overlooking a key component of their health, one of which I'm really excited to sort of unpack today, which is the mitochondria.
Yeah. I mean, if you go back and, you look at the first chapter of any pathology book, for the most part, most disorders start in the mitochondria and work their way out. So
Sure.
it's a really critical topic.
And I have an outline for us. I was saying before we started the recording, knowing that you and I get into the weeds, I wanted to help give us some sort of outline just to flow through this with people. So for the audience, here's what we're going to walk through. Firstly, what are the mitochondria? What do they do? Second, how do the mitochondria become damaged? Third, the signs and symptoms that you might have mitochondrial dysfunction. Fourth, how this relates to the cell danger response, which is, I think, a really critical shift that if we can help people get out of that is very pivotal. And then fifth, what can we do to get people out of that sort of stuck mitochondrial state to improve or thwart, stop that cell danger response so people can improve their health, whether it be neurological, gastroenterology, wherever their symptoms are manifesting. And usually it's sort of multiple systems or symptoms that will manifest. But let's start with the mitochondrial overview and kind of give people the rundown of what they are and why they are important.
It's a perfect place to start. So a couple of things. Usually when you see, drawings of a cell, you see one mitochondria in there to represent what they do. And what's important about that is a couple of things. One is they create the energy units, the ATP, that help the cell do anything that requires energy. So that could be membrane receptors. It could be all sorts of operations. The other thing, though, is that different types of cells have different numbers of mitochondria. So it would be impossible for a cell to run with one mitochondria. And when the mitochondria start to become dysfunctional, they decrease the amount of energy that the cell's able to use, and then that can create other problems. So if you're having mitochondrial problems, the other side of the coin is your different tissues in your body have greatly different numbers of mitochondria per cell based on their energy needs. So, for instance, your brain and your heart have thousands and thousands of mitochondria per cell. Our skeletal muscles that we work out at the gym, those are going to have 2 to 500 per cell, for example. GI tract's going to be in the middle, the liver's going to be in the middle, and it just depending on your needs. So if you start to have trouble with your mitochondria, you might notice it in the areas that have high density of mitochondria first.
Yep. Which oftentimes is the brain. I think that's one of the most acetylene symptoms for
Yeah.
people. And
Yeah.
there's an interesting cascade. I mean, there's many cascades in physiology, but what seems to happen is if brain function is impaired, and we'll see this in the clinic sometimes where people, they've been really hitting, let's say, SIBO, small intestinal bacterial overgrowth, quite hard and seen some flicker of response, but there might be a brain component to the SIBO that hasn't been addressed. And so, to your point, if there's a really high density of mitochondria there and mitochondrial function is being impaired or thwarted by this cell danger response, then what's governing gastrofunction, the brain, might not have adequate signal to allow healthy gut function to propagate, if you will.
Yeah, definitely. Yeah, I mean, obviously, we're all connected. The tissues don't work separately, although we think of it that way sometimes. And I think the brain symptoms, whether they're obvious, like something like brain fog or sleep disturbance or other things like that, or the less obvious, like you were saying, the brain is doing all of this neurological feedback operation to run our GI tract and run all of the ancillary organs that help you digest, for example. And if you run low on energy, you can't do those things in an appropriate manner. So you wind up with, you know, all manner of issues that may
Right.
come up.
Which are, these dysfunctions of multi-system etiology, they seem to be getting more common, and it's probably in large part due to the environment and our lifestyles are not conducive to health, including mitochondrial health. What are some of the more common environmental or sort of modern day triggers that are not healthy for the mitochondria?
Yeah, the I usually like to think of them kind of going from the more uh what you might call hygienic or determinant of health basis
Sure.
towards exogenous problems. So one thing that's easy to forget about is we do a lot of recharging and regenerating of our energy apparatus when we sleep.
Sure.
And people who are chronically sleep disrupted have a lot of disrupted signals going back to the mitochondria in regard to, healing and regeneration. The other thing I think that's a modern twist on this, because of course people have had trouble sleeping forever, but is the sort of light pollution that we all have.
Mm,
We all have these screens. We now have screens that we can take with us everywhere and in bed and all that. And our brain gets very confused when we have all this light that,
right.
is not set up. But yeah, basic things like that. Um, Definitely micronutrition is, the mitochondria run on nutrients, so that becomes a pretty big issue. And that could be you could be trying to eat really well, but if you're not digesting and absorbing for many reasons, you might not be getting nutrients where they need to go. But then I think that the real modern issues really are toxicities and toxicants that are of a huge spectrum. Um, that could be the common things we think about, like metals or certain chemicals. It could be things that are, a little bit harder to put your finger on, like mycotoxins or other biotoxins in the world. And if you think about the amount of toxicity that's just in our environment and in our food and in our air, take now to 100 years ago, it's not even the same level of toxicity.
Sure.
And as we talk about later with cell danger response, toxicants are something that are going to interrupt the ability for everybody to have homeostasis and work correctly. So I think that's a huge thing.
Oh, and by the way, if this is helpful, please comment. I'm always curious to engage. Subscribe so you see future videos from us, and share with someone you think this might help. Sure. And again, this theme of some of these perpetuating loops comes up again. If your gut function isn't healthy, you can't absorb key nutrients that are needed for the mitochondria. If you're not sleeping well, that can interfere with mitochondrial function, which is in part needed to regulate sleep. So, yeah, I guess it's good news or bad news. If the cycle is self-perpetuating in a bad way, then that's not good. But the silver lining there is once we understand that, we can interrupt that and start to get these cycles to function for us in a favorable direction. I'm sure people are wondering, well, hey, how do I know if my symptoms, the grab bag that people have, and there's a lot of overlap, but I'm assuming there's also some nuanced differences. Sleep problems are common, energy problems are common, bowel and GI issues are fairly common, but are there hallmark symptoms? You alluded to maybe brain symptoms being some of the more common, but what do you look for as sort of keystone symptoms that perk you up to say, there might be a mitochondrial issue present?
Yeah, I think, and because everything is connected, and it's never just one thing that's wrong. You also have to consider what else might be going on. But one of the things is taking a kind of a step back and a macro look at, did this person um, have a real long kind of slow slide into ill health, and their symptoms have been stacking up over time, and they're 3 years ago or 5 years ago they were 80% better than they are now. That's often a tell that regardless of what got them where they are now, the long, slow slide has taken a toll on the mitochondria both in the obvious organs. So let's say they're presenting with digestive problems or brain, but also in probably the rest of their body as well.
Sure.
So that's one huge tell, is the overall picture of how did this go on. Now there's a subtype, which is a more rapid insult. So a person, you know, seemingly was healthy, they didn't have these symptoms before, and they get some very noticeable insult. We see this with long
Mm,
COVID patients, for
right.
example, or other people, and it's really an exposure, and in the case of virus, it's an exposure to an immune disruption. In the case of other things, that could be a toxic exposure, like we see this with mold patients, for example.
Sure.
So if they sort of go along, they seem okay, and they kind of fall off the cliff health-wise, that's another one where you throw enough disruption into a healthy body, and it will just stop operating normally. So those
Sure.
two patterns, I think, are really important. Then there's just the more symptomatic things, which are those global constitutional things like fatigue, brain fog, or aggravation of other neurological types of symptoms, even muscle pain, muscle aches. And what we see a lot is an inability for exercise to be regenerative,
Mm,
because they're working out and they can't recover like they used to, say, 10 years prior. That's a mitochondrial deficit as well.
mm. A few things that I've been thinking about, also curious your take on these. I wouldn't say it's the only one. It's one of a few, and I agree with everything you said. But a couple that I've been sort of reflecting on some cases in the clinic, and seeing people come in banged up, and then we sort of got to the underlying causative factor, which we're outlining. There can be many of them, but it may have been mold, it may have been a chronic infection. There's a sort of commonality of chronic inflammation that underlies a lot of this disruption of mitochondrial function, but
Mhm.
fasting intolerance and low carb dieting intolerance. They can't do low carb, they can't fast. And there's been a few cases, and I know we'll talk about this more a little bit later, but where hyperbaric oxygen chamber therapy really helped these people be able to
Mhm.
hit fasting physiology, whether it be just a true fast or a low carb keto, I'm not saying forever, but if we're trying to do a reset for a month or even a few weeks, if people can't flip into that fasting or low carb physiology, because the mitochondria are a huge component underlying that, that to me is one signal that mitochondrial dysfunction might be present.
Yeah, definitely. And for people who may wonder, well, why would that be? If you, well, certainly if you have a fast, either a shorter or longer fast, but even if you lower the carbohydrate intake to do, say, ketogenic or low carb, the mitochondria's easiest energy source are carbohydrates. And so you'll see this in people where as they get sicker and the mitochondria are weaker, they'll actually have more carbohydrate cravings, and that's actually just trying to get simple energy in there. And so people, who maybe studied nutrition will say, well, but fats are a lot more, calories per. They're a lot more efficient. What's the problem? Then you go to, low carb or keto or even fast. Well, the problem is the apparatus to get the fat in the mitochondria to burn up is a lot more energy dependent. So yeah, a simple thing like that of not just being, low carb intolerant, basically, or we do a lot of short, you might say, or intermittent fasting with people for resets. And the people that really go off the rails with that, yeah, their mitochondria are not set, and there's a number of reasons to use the fats like they ought to. So that's a huge.
And, one parallel maybe for our audience who I know are very astute with gut health, a healthy gut should be able to process fiber, prebiotics,
Right.
but an unhealthy gut
Yeah.
can't make that shift. So if we have a healthy organ, let's say, or organelle, then you should be able to be metabolically or let's say, substrate flexible, high fiber, low
Mhm.
fiber, high carb, low carb. And if you're not, I wouldn't say force your way through it, but use that as a signal, as a clue that, okay, there's something upstream that's altering GI function or mitochondrial function or what have you.
Yeah, definitely, definitely. And you can see why if that's going on and you're not really thinking about it and you're the patient, it could be months or even years where you've slowly shifted your diet just for expediency,
Sure.
to get the nutrients in as quick as possible. And you're not, as you say, you lose that ability to deal with, whatever the substrate is.
Right.
So, yeah, I see that a lot. And the upside is you can undo it. The downside is you have to stop the ship from going down that pathway.
And part of that pathway is this cell danger response. So
Yeah.
let's explain this to people because what's exciting about this is as it's gaining more notoriety, more acceptance, I think it's uncovering a big, perhaps previously missing piece to why some people stay stuck. So let's define it and kind of start walking through what it is and what it means.
Yeah, the cell danger response is quite interesting because it's essentially describing what we see clinically in people who often have chronic illness, and it's based largely on the work of Dr. Navio, who has published papers on it and elaborated the idea behind it. Obviously, it's gone on for a long time. He's just been one of the people kind of championing
Sure.
understanding. But the simplest way to think about it is we under normal circumstances, obviously our cells turn over all of the time and we have repair mechanisms and all that. The mitochondria have their own repair mechanisms and their own cycles that they go through because they don't last forever either. So under a normal non-cell danger response, the mitochondria are challenged in some way and they send out signals, immune and chemical signals, to try and recover. And in recovery, they go through mitogenesis, so building of new parts or even new mitochondria, and they sort of circle back then to healthy. So you start healthy, you have a challenge, you have recovery, and then you go back to healthy. The cell danger response puts a wedge in there And the wedge normally, and the lists are quite long, but they're all of the things like we talked about earlier that could be epigenetic triggers for things to go off the rails. So easy ones to think of are all the toxicants and toxins in the world. Those are,
Hmm.
real common and probably why we see this a lot more. Others, though, include chronic stress that doesn't have an outlet, and the body's stress hormones get out of balance,
Right.
which throws off blood sugar control and all kinds of other things. Um, and then other things that can do that beyond general toxicity, et cetera, can be either chronic infections or immune problems that derail the signaling chemistry for the mitochondria to go back to, the healthy side of the cycle. So whatever the wedge is, it gets in there, and then the cell has feedback to say, oh, well, we're not going through mitogenesis to recover our mitochondria. We must be having a big problem here. And so then it goes into a dysfunctional state. And what I would try and relate with patients would be, if your mitochondria stop working, you're dead. So you're obviously not dead. You're here with us, but you feel horrible chronically. The cell danger response essentially takes a mitochondria that could be operating at 100% and maybe it lets it operate at 20%. And that's
Right.
its max because it's damaged. Well, if your trillions of cells and all the trillions of mitochondria start to operate less than 100%, you get symptoms. So that usually it presents as fatigue and pain and all the things we talked about. But the longer you're in a cell danger response, the more trouble. And then the other side of the coin is if you come in and you do too much treatment to recover the patient, so you push too hard on the mitochondria, you can actually make the cell danger response get worse.
Hmm.
So you have to kind of have this balance of saying, okay, we got to figure out what put the wedge in here to derail our normal, cell maintenance, mitochondrial maintenance. We have to slowly work those things down or out of the system or, decrease them and then put the good things in to help the mitochondria recover.
Yeah, I think that's well said. We see this a lot with chronic infections where, understandably, when we help a patient identify some sort of chronic infection, they are really eager to get rid of that as quickly as possible. But I often explain it's kind of a dance because when we start treating that infection, it's going to increase inflammation, which is going to
Yeah.
thwart mitochondrial function even more and also lead to a lot of other systemic inflammatory symptoms, people feeling worse in a sense. So we kind of have to make sure that we try to throttle down inflammation and use antioxidants so that we're not letting the sort of microbial killing inflammation greatly outpace what the mitochondria can sort of handle and keep this delicate balance to your point. And I think clinicians have made that mistake. I would say heed your doctor or your clinician's recommendations on this because you make that mistake a few times when someone says something along the lines of, "Doc, I'm desperate. I'll do anything. I want to hit this hard." And you try to help them do that, and then a few weeks later, they're far worse. Maybe there was a honeymoon period of a week or so, and then they crash. So heed that warning, guys. Slow and steady in many of these sort of feedback loop recovery situations wins the race as compared to hard and fast.
Yeah. Yeah, 100%. And of course everybody has different reserve capacity and some people can hit things harder and others like you say there's a little honeymoon period and then they're really happy and then 2 weeks later they're not very happy
Right.
because they crashed. So yeah, a lot of it is personalized feedback in that because you can't from the outside look at somebody and say, "Oh, you're for sure, going to need this amount of time or this amount of, sort of low and slow."
Yep.
The body tells you. And I think especially in chronic infections, and the same happens with toxicity because it's a chronic
Sure.
problem generally.
Yep.
If that was the only problem, then just killing the infections would make everything better. And we all know that, that's a piece of the puzzle. but that's not the whole puzzle. It's we're trying to take away one of the things derailing the cell response and putting us into cell danger, but we have a lot of other healing to do to, kind of catch up with that. Same if you detoxify, et cetera. Yeah.
Sure, sure. And there are some things that can be somewhat predictive, although to your point, I would strongly agree that a lot of this you won't have a read on as a clinician until you start and you get some biofeedback from the individual. But severity of symptoms and chronicity of symptoms tell you, okay, how much reserve does this person have? How hard can we push? But nevertheless, sometimes the body will surprise you and throw you a curveball. So that's where personalized
Yeah.
medicine usually wins.
Yeah. Very true.
All right, so let's walk through now some of the tools we can use to treat or unravel that cell danger response. Um, I think of this starting with the foundation and then working our way up because there's so much here from dietary changes to cool lasers, red lights, and hyperbaric oxygen. Starting with that foundational layer of diet and lifestyle, what do you think about as some of the most important foundational supports here?
Yeah, I think very important to start with the foundational things. And a lot of times, eh, patients might get, concerned or even, you know, lose motivation because they'll think, well, I tried to change my diet or I tried to do more exercise. I tried to do this and it's not doing anything.
Right.
The way I sort of explain it is, there's three big pillars under which there's a lot of little ones that you have to just keep as the base, and then all the other cool treatments we do will work better if you're doing that. So I make it simple. I say there's three big pillars: food, muscle, and brain.
Mm,
So food is obviously nutrition, but also the cleanliness of the food and what you're eating and drinking and
right.
your micronutrition, all those cool things, which can change over time, the needs. Um, Muscle is literally, as we all know, muscle and fat have two different sets of signals they send to the body when they're active biologically. Muscle literally sends healing chemistry out to the body. And there's even more recent publications showing that just activating your skeletal muscle, moving your body, will heal up things like your blood brain barrier problems and inflammatory things. Muscle, when it's real active, sends out blocks to healing. And
Right.
so, people will say, well, do I have to become a marathon runner? And so, no, it's just you do a little more with your muscle and less to trigger your fat cells to be active. It's going to be a net positive. And then, brain is obviously everything, but beyond the mind body connection, it's also um, what you're allowing in as far as positive and healing sorts of things. Are you always hearing about negative things? Are you always hearing, oh, you're going to be sick forever, and all of
Mm,
that?
yeah.
So it's a lot of things. um, and then once those areas are kind of looked at, then like I say, all of the stuff on top of it will actually work better. And I usually think of starting then with, well, what would I add to those things? That could be more specific micronutrients, or you mentioned antioxidants, could be certain botanicals to help with particular problems a person, maybe inflammatory issues, et cetera.
Sure.
Um, and then a layer above that of sort of the external things, which might be, light therapies, hyperbaric, all the cool things. Yeah.
Right. Right. With food, are you trying to go moderate to lower carb and sort of trying to be cognizant of not pushing someone farther or lower than their mitochondria can go outside of the really important basic piece of clean air, clean food, clean water, right? No toxin. So that's a
Yeah.
given. But from there, where do you go next?
Yeah, the way that, and again, some people can kind of do all this at once, and some people it's really baby steps.
Sure.
So we have a patient education aid that's basically a pyramid. The bottom layer actually is working up to a 12 to 13-hour intermittent fast every day. Now we can't always start there, but the reason it's at the bottom is because of the ability to help the cells take the trash out in autophagy and do a number of other things. The next step actually doesn't even get to macros, it's cleaning up. So taking out any obvious preservatives and dyes and the junk that comes with our food.
Sure.
And then the next is getting rid of any source of simple carbohydrate, too fast burning, starches, etc., and making the carbohydrates more complex vegetable, material, which is going to help on a number of levels. And then the next steps above that, we kind of personalize, but they're generally a lower carbohydrate type of a diet. Some people, it's intermittent fasting and even keto pending. Um, but the idea being once they tolerate that, then you're allowing the cells to actually take the trash out easier, which helps to decrease the cell danger response. You're getting sort of high concentration nutrition through, say, a lower carbohydrate diet, and you're retraining the mitochondria that they can actually do this. They can burn the fats
Sure.
and have high energy needs met. So yeah, it sort of goes in that order, and most of the time that works for folks.
Okay. Regarding a brain therapy that I'm pretty interested in of late is vagal nerve stimulation therapy, especially auricular or through the ear, essentially a set of headphones that will stimulate the vagus nerve. And the vagus nerve is the main sort of parasympathetic or rest and digest superhighway. And it does go both directions. And actually, most of it goes up to the brain and helps retrain the brain out of a chronic stress response. You can get vagal nerve stimulation through prayer, singing, humming, meditation. But for some people, especially if their energy is really low, I'm going to ask you to change your diet, take some supplement, or I'm going to give you more to do and then ask you to do additional other lifestyle changes, knowing that some people might have limitations. I really like the passive nature of these vagal nerve stimulating earbuds in that you can do it while you're, reading in the evening or watching TV or, washing your dishes, whatever it is. Is this something that you've explored much at all?
Yeah, and I would say, although we've known about how the vagus nerve works forever, I would say vagal nerve types of therapies have I've been much more aware of them in the last 15 years, and I've seen them, develop so people can actually use them more easily.
Right.
There used to be a lot of kind of more invasive types of vagal
Yeah.
nerve sort of
Implanted.
therapy.
Sure.
So
Sure.
yeah, so the ability to have things like a headset, earbud, some of the other external types of things has really helped because anybody who's dealt with chronic illness, it's hard to manage all the things that you're trying to do. And the easier it is for something so core to
Precisely.
just be part of, like you say, reading in the evening or, whatever you're doing, um, the more likely you are to do it. And also the more likely it is to actually help you out. Um, and yeah, the effect of, vagal derangement, as you say, you've got kind of two-way messaging. Two-thirds of your digestive tract is really serviced by, the vagus nerve, and feedback goes. So because, as we talked about at the very beginning, if our digestive system gets off track, we also aren't going to absorb micronutrients. It's going to be harder for us to do all sorts of things, and we're going to be much more inflamed. Getting the vagal tone back is incredibly, important. And I'm really glad there's these much more simple, much less invasive sorts of
Yeah.
therapies
Yeah.
available. Yeah.
Totally agree. Totally agree. Um, Nutrition. So obviously, the mitochondria has a number of components, the cytosol, the Krebs cycle, the electron transport chain that help take our nutrients and from it make energy. And people have probably heard of things like NAD supplements or molecular hydrogen or carnitine or CoQ10. B vitamins, right? A lot of these either provide precursors or antioxidants or just the cofactors that are needed to spin these turbines of energy production, if you will. There's a lot of options. To simplify, do you have a short list that you think are, the most important for people to focus on, regarding the 20 or so options that people may have for different supplements or plus?
And that's always critical because theoretically you could take everything, but it's not very efficient, and no one's going to do that for very long.
Right.
So, kind of to your point earlier, where we're talking about, well, how long have you been sick? How significant is the illness, et cetera? That factors into, do we just start with the basics that are real targeted to kind of get the system operating again?
Right.
Or do we do that and do an accessory treatment that might be there for a while to help us out?
Hmm.
So the the basics at the very least, carnitine is usually a primary treatment for me because it's what helps get the fatty acids into the mitochondria to burn them,
Sure.
the amino acid carnitine. And a lot of people, like you hear about the keto flu and stuff like that, a lot of times those symptoms come because we're trying to burn more fats for energy and we ran out of enough carnitine. It's sometimes that simple. So carnitine's a really core thing to help feed the machine, so to speak. Um, if you look at the way the human cell protects itself with antioxidants, you definitely need more of those, especially in cell danger response, because you're getting stuck and creating more inflammatory chemistry. The cell starts with just three things. There's glutathione, vitamin C, and then vitamin E.
Hmm.
And vitamin E kind of hangs out in the fatty membranes, but vitamin C and glutathione help cycle each other in the mitochondria and the cytosol, et cetera. So if those are not, sufficient, um, you got to fix those, and then all the other, kind of higher level antioxidants will work better. Um, then, once we kind of take care of the redox inflammatory thing and get enough carnitine to get the energy in, your mitochondria basically run on B vitamin, minerals, and a couple of other nutrient substances. So then you have to look at, well, how much of that am I getting? Uh, Obviously, if I'm still sick and tired, et cetera, I need more. And which ones might be kind of high value. So one that, and here's the other thing, a lot of these things help the mitochondria, but help everywhere else, right?
Sure.
So, for example, coenzyme Q10 is actually used in the mitochondrial complexes in a couple places, and it helps other stuff in your body. So it's sort of like that's a easy one to add in.
Sure.
Um, for some people, alpha lipoic acid is also helpful. It's sort of a collateral helper, but it also does a number of other good things too. But then when you get to looking at, okay, NAD support, that's really big because there's lots of YouTube videos on it and stuff. Um, NAD, NAD's family, it cycles around. That's actually where you first get the energy units to run the mitochondrial complexes. So if we are low in NAD, the mitochondria slow down. And NAD is made from a form of vitamin B3 with some other steps, and it's the active form that does that. So because of the other cofactors needed, the first thing you want to make sure is the person has enough of all the B vitamins so that that'll work. And then a lot of times, and people now will often come in saying they've tried this or that or the other thing. There's oral precursors that help with NAD, so nicotinamide riboside or nicotinamide mononucleotide, things like that. Those are often helpful, not that you need them forever, but if again our energy is running at 20-25%, if we put more substrate in to run the system and we've got all the other things, uh, we're going to get more energy out of the system.
Sure.
So NAD support's kind of a core, really. Um, Another one that people will use, which again is not part of your body, it's an accessory, but it can sort of jumpstart things, would be methylene blue.
Mm,
Um, that's a it literally comes in kind of on this. So NAD starts at the beginning and just primes the system naturally. Methylene blue comes in on the side and sort of speeds the process up. So it's literally like an adjunct that you don't need that forever. Really fatigued people sometimes will help. You do have to be careful because there's like methylene blue can carry a lot of toxins. So you really need a supplement that's
well
been
sourced.
checked and
Yeah.
hyped,
Yep.
all that. Yeah. Um, and interestingly, the other thing that kind of comes in on the side and supports that is red and near infrared light. The
Mm,
mitochondria are very responsive to light. Um, and we've been doing a lot more of that over the last 10 years as well, especially with people who are really fatigued. Light therapy can be a very gentle but kind of persistent way to wake the system up, so to speak.
sure.
So there's a lot of options really to, kind of get in there. But I always tell people, let's make sure the core is covered, the original equipment sort of nutrients and the antioxidants, and then we can always build on top of that, if
Sure,
needed.
sure. And I'll just kind of echo one of the things we covered earlier, which I think is so easy for the non-clinician to overlook, which is what is the chronic source of inflammation, an infection, mold exposure, maybe long COVID. What is it that's sort of causing this chronic inflammatory response? You're using up all these resources, whether they be cofactors nutritionally or antioxidants, because if that's not done, and feel free to disagree with me, but if that's not done, I don't think any even perfect mitochondrial support program is really going to get you out of that stuck state.
Yeah, no, I wouldn't disagree with that at all. I think that that there's two things there. One is, and we see this with patients all the time, because there's so much information about NAD or other things that help your mitochondria. People already tried things, and sometimes they'll say, "Well, I can't." This is common. I can't take NAD support because I got really sick when I took it.
Mm,
And what I usually say is, well, your mitochondria are running on NAD right now. If you get sick when you do mitochondrial support, it means you sped up a system that has too much interference. It's sort of like
yep.
putting
Well
more
said.
gas to a motor that's that needs to be tuned up. And so, yes, maybe let's not push too hard on that. But the other thing that people notice symptomatically is we think about cell respiration through the mitochondria. Oxygen goes in, CO2 goes out, which is true. Energy comes out. But the other thing is when we're doing cell respiration, we trigger the cells to get rid of other metabolic junk that's inside the cell beyond carbon dioxide.
Mm,
So if you're really toxic and I speed your mitochondria up, you're going to suddenly start moving all this trash out. And that may not feel good for a while. So yes, to back to your earlier point, raising the level of things that help me deal with that, such as antioxidants, for example, but also a lot of people get constipated or bowel dysfunctions if you're not eliminating through your GI tract appropriately. And that could be, your gallbladder and your bile is not moving as well, or your bowels are, slow or intermittently slow. You're just going to recycle all that junk and feel worse. So that's when I'll tell them, okay, if you had this symptom of mitochondrial support equaled feeling bad, we're going to do this really slowly, but we have to start to let your body get rid of this junk so that doesn't happen.
yep.
Yeah.
Yep. Yeah. And you see that with some B vitamins. People will make a remark that I felt too sped up. I couldn't sleep well. I had a headache. Sometimes with red light, same thing. And that's actually been a really big gift at the clinic is helping to slow people down and coach them through reorienting and interpreting negative reactions as telling us we're doing something that we need to do, but we may not have the adequate anti-inflammatory supports or detox support on board to allow that function to be brought up to more normal speed because it is kind of pushing out toxins or maybe kicking up a little bit of inflammation as the mitochondria start making more energy, and your stores of antioxidants are so depleted that you can't even handle that transition. Almost like someone who actually, to your earlier point about exercise, they start exercising and they're floored by it. Well, in normal physiology, people should be able to recover. So it's a common theme here that if things that should heal don't, it doesn't necessarily mean totally avoid those, but look at that as, okay, how can I better understand what's going on in the system, remove the monkey wrenches, and then I should be able to heal and improve from those therapies.
Yeah. Yeah, that's a huge tell. And once patients actually internalize that and realize it's not an all or nothing thing, but that may mean we have to slow down the one side of the equation and increase the removal of the interference, whether it's infectious or toxic or whatever, which can
Sure.
take some time. And the same with exercise. A lot of our patients that are really sick, they will have tried to exercise because they heard it's good for you, and then they're just like 2 weeks of recovery where they don't
Yeah.
feel well.
Yep.
We'll literally just say, okay, if that was your experience, you still want to move your body, but just a little more than you normally do. And as you get healthier, your recovery will get better. But don't push yourself into illness,
Yep.
because of it.
Yep. Well said.
Yeah.
Well said. Let's talk for a moment about hyperbaric oxygen. And this is something I've mentioned on the podcast before, that once we found a company that will actually ship people a hyperbaric unit to their home and allow them to rent it for a month or two, it really made this much easier for people who weren't near a clinic to be able
Yeah.
to do so. And boy, we've seen a few cases where people were just tough, chronic fatigue, exercise intolerance, where this really started to bring them back to life. Um, Obviously, there can be a whole podcast dedicated to this topic, but are there a few high-level points about hyperbaric that you think are interesting?
Yeah, and I've experienced
Mm,
the same thing. Our various clinics have all had hyperbaric capabilities, and we still do. The thing I think that for people to envision is your your body carries normally its oxygen on your hemoglobin, and there's only so many places to carry oxygen. And then in normal physiology, there's a tiny amount that is free oxygen in the plasma. What hyperbaric oxygen does is a couple of things, but one is it saturates the plasma with more oxygen. And also, it saturates not just through the normal, circulatory measures, it saturates your tissue beds with
mm,
more oxygen. So you're getting more oxygen kind of from two different pathways. Your mitochondria must have oxygen to run oxidative phosphorylation to make ATP.
right.
If, if you then increase the availability of oxygen, at the side of the cell, oxygen naturally goes down in a gradient. So normally it's a pretty big gradient just from breathing. If we supersaturate your body, the gradient gets bigger, and the mitochondria are going to process more oxygen, make more ATP, et cetera. And so that's a very important process. It also helps to one way to think of it is kind of triggers your oxidative reductive cycles. So these are the cycles that you oxidize or you get inflamed, and then the antioxidants are triggered to go up and take care of the inflammation. So hyperbaric also is triggering those processes, which again are helping to decrease your inflammation and all of that. And like you say, especially where they can do home treatment, so it's more available, and because it's any treatment you have to drive somewhere for. It's harder to get to do that.
Absolutely. Yeah.
Um, and so, the home units, which are lower pressure, much more gentle, they're very able to help people kind of stimulate this process. And again, all the things we talked about before apply. If a person is really toxic and they just feel really, kind of bad after a hyperbaric treatment, usually it means that they need more antioxidants, they need more elimination, pathways looked at, et cetera. But
Right.
hyperbaric is an incredible treatment for really all these things we're talking about.
And one point I'll make for the audience, kind of coming back to that principle of don't misinterpret a negative response, meaning that you shouldn't use a given therapy. There was one study that was fairly elegant. It found inflammation increased up to the 10th hyperbaric session, and then it decreased after that. And I look at it similar to exercise, where you're probably going to have some, when you're sedentary and then start exercising, some upregulation of muscle inflammation until the body, as you were saying, increases repair and including, in this case, endogenous antioxidant production. So at first, if you feel a little inflamed, you get some joint pain, you feel fatigued to a degree, right? Not severe, but to a degree, you may want to push through that until you get to about the, just over the 10-week mark. And that's when you may see things shift and start noticing better cognition, better sleep, less joint pain, even less digestive dysfunction. Actually, there was that really pivotal meta-analysis finding about a 50% either response or resolution rate of inflammatory bowel disease with hyperbaric, which is fascinating. And obviously, that's going to give us a lot of bang for our buck because we're absorbing nutrients now. We're getting nutrients to the brain. We're reducing inflammation. So just one more time to reiterate the concept for people not to jump ship from a therapy too quickly.
Yeah, I think all the therapies we've talked about can do that, and and a lot of it too is when the patient leaves our office, we try to remind them, hey, this is your journey, your body's going to do its thing. So if you have one of these responses and we need to adjust, let's do that right away
Sure.
and make the journey easier.
Right.
You see similar things with fasting therapies. You get more inflamed early on. Your mast cells really upregulate and then they go down, and all your inflammation. And we talked about, light therapies and heat therapies and things. Same thing happens. Um, Most people do really well with them, but they can be a little overstimulating to the
Yep.
system.
Yep.
We have to go more slowly.
Peptides is another very interesting therapeutic here. SS31 and MOTC are two that I think are pretty interesting for their impact on mitochondria. But I'm wondering, do you have any favorites here in this new exciting world of the 1,000 peptides that are out there
Yeah,
available?
all of the peptides.
Right.
They are, I think because they work at such a core level in your biochemistry and your physiology. So peptides are just, small short strings of amino acids that are going to plug into a particular place and usually either help a regenerative process or stimulate a process, etc. Um, One of the issues, as with many things, is that the government regulation around what peptides you can get and how you get them and all of that has been just it's been a moving target, and
Yes.
and continues to be. There are some really good high quality orally available peptides that I tend to use a lot because people don't have to inject them; they can take them at home, and all that. Um, One that we use a lot to kind of step back away from the mitochondria more, but to help kind of cleaning out the inflammatory blocks, um, especially when there's been chronic infectious problems, is thymosin alpha, for
Yeah.
example,
Yeah.
helping especially the cell mediated side of the immune system and all that. So it's sort of like you can work your way from the outside in. And then, as you mentioned, there's some very specific to mitochondrial regeneration, mitogenesis, and they all can be, very useful. So people often say, well, what would be the difference between NAD support and B vitamins, et cetera, and then doing,
Mm,
say, mitochondrial specific peptides? Well,
right.
your one is feeding the system with the normal substrates it used to make energy. The other is going to this area in the cell danger response, especially where you derail because of inflammation, infection, toxins, whatever. And your body has signals to try and heal the mitochondria, but the signals are so slow, you're not healing as well. So these, peptides can be used to kind of reconnect the dots as far as your
Sure.
mitochondria healing.
Yeah, that's a
Yeah,
great point.
been a huge addition to people clinically, really, I think.
Yeah, and to your point, it's nice to see some of the oral options popping up and becoming more available for access. And also, some people just, they don't want to do an injection, even though a subcutaneous, a pinch of back or belly fat is really literally a small pin prick. Some people just, they don't want to do it. So if
Yeah.
we can get decent absorption orally, then yeah, I'm with you. And we have seen some of those oral peptides work, seemingly as well as the injections.
Yeah. Yeah, I think a lot of it's the delivery mechanism, and there's probably a couple companies that have that figured out seemingly. I've used more and more of those. Again, it's sort of like, you know, a home hyperbaric unit's gonna get used more. Um, Definitely though, if people yeah, a subcutaneous injection, especially with most peptides, you almost don't feel it. It's very, very tiny stuff. And if that's really helped somebody, they'll be very, excited to keep doing that,
Sure. Yep.
as they go on.
That positive reinforcement.
Um,
Sure.
yeah, the oral ones are just a little bit the bar is a little lower to get over, I think.
Right. Right.
Yeah.
Paul, this has been a great conversation. Any closing thoughts or advice for people?
Yeah, I think two things. One would be we talked in different parts of our discussion about it. I would say one of the other things that people can do at home, certainly in clinic, but at home, that have been game changers are red near infrared light therapies. And there's so much better, availability. So they not only help your mitochondria operate better, they also help a number of other processes as far as inflammation, et cetera. So just one therapy that is right up there with hyperbaric, et
Yep.
cetera.
Yep.
But I think from the macro point of view, if you're going through chronic illness and you see, oh, this concept of the cell danger response and the mitochondria need to be fixed, but the cell has all these other issues it has to deal with. So your point of a negative response is not always bad. It's a signpost that means we need to
Mm,
support something or speed up or slow down something, et cetera. That's the kind of feedback you and the provider need to have, and you'll get through the process much quicker than just trying to white knuckle through, some
sure.
negative effects. And I think that when you've been chronically ill and you've been sick and you're not getting answers, it's really demoralizing if you don't understand that, okay, negative experiences that lead us to better therapy as we go through are actually positive experiences. They're
Yeah.
just uncomfortable. They
Yeah.
get smaller as time goes on. So, hang in there to everybody who's got these things going on. It takes time.
Yeah. And that's a great point. Also, so that people would or will avoid white knuckling, but also so you can bring that feedback to your provider because sometimes I think what happens is two things. People become hyper accustomed to avoiding anything that doesn't feel good.
Right.
Um, and also, they may just what I call provider hop, right? I start with this new doctor, had some negative reactions. Oh, they don't know what they're doing. And then you go to the next person. And if the clinician just had that one or two opportunities of the feedback loop, they could navigate you through it. And I get how dissettling it can be. Let's say you waited a month to see the doctor, and then you went through the whole, hour and a half intake, and they dug, and you really felt like this person finally understood you. And then the first recommendation they give you, you feel worse. I can understand how that's just totally demoralizing, but just keep in mind that sometimes you're one follow up and one feedback cycle away from really getting on the other side of that. Paul, where are you
100%.
hanging out these days? Anything new? A website, blog? Where would you point people?
Yeah, I finally got smart and made a hub website that has links to my YouTube and my newsletter, all the stuff. It's just DRANOW, dranow.com. And we have a very large YouTube patient education site that has grown a lot.
Great.
And that has all sorts of chronic illness oriented topics.
Perfect. Well, Paul, I appreciate you and your work. Thanks for coming on and explaining mitochondria and the cell danger response.
Thank you.